I think so.
Good morning. I'd like to call the Finance, Ways, and Means Committee to order for November 14th, 2023. Madam Clerk, would you please call the roll?
Representative Barrett. Here. Representative Baum. Representative Boyd. Representative Camper. Representative Cochran. Representative Crawford. Here. Representative Faison. Representative Freeman. Here. Representative Gamp.
Here.
Representative Garrett. Representative Hawk. Representative Hicks. Here. Representative Keesling. Here. Representative Lambert. Representative Love. Representative Lynn. Representative McKenzie. Representative Miller. Representative Moon. Representative Parkinson. Representative Shaw. Representative Sparks. Representative Whitson. Representative Williams.
Here.
Representative Zachary.
Here.
Chairman Hayeswood.
Here. Thank you, and thank you all for being here today. I know several people let me know they have conflicts. It's a busy time of year, but then I've come to understand that there's no unbusy time of the year. At least I haven't seen that. So before we get started, are there any personal orders or announcements? I have one. My grandson is 15 years old today. So happy birthday, Sawyer Hazelwood. I know he's not watching. He is home from school because he's sick, but he's not this bored. But at any rate, today is a big day, and I just want to let people know if you live on Signal Mountain or anywhere between Signal Mountain and Macaulay School, we'll soon have a new driver on the road. He'll be getting his permit, so careful. Representative Gant.
Thank you, Madam Chair. I have a question for you in these hearings going forward. Is there a schedule yet for these hearings that we can kind of anticipate?
Actually, these hearings are a little bit special. They're not our normal budget hearings. We call these focus hearings because we're basically using this opportunity and this time to kind of follow up on some things that the legislature, some legislation, some budgeting that was done for this budget year. Now that we're in that year and in that process, we just wanted to get a little bit of an update from some of the departments on how these things are working, so that when it does come time for budget hearings, we can focus on next year's budget and, not have to go back and hopefully revisit some of this. So we are looking at a schedule in early January to have some of our smaller departments in, as we did last year, but that'll be, after we start session, and then we won't have our major budget hearings until after the governor's state of the state, after we get his budget as normal. So,
Okay, thank you, Madam Chair.
any other questions? All right, well, thank you. I'm going to ask, I see Commissioner Williams, her smiling bright face, and her staff are with us today. We're going to ask them to come up, and they're our first presenters. And we hopefully may have the Department of Education may join us before this scheduled focus hearing is done. If so, we'll bring them up and let them join you, because what we're talking about with Commissioner Williams and her team today, a lot of it deals with a collaboration between them and the Department of Education. But what I'd ask the commissioner to do is talk with us a little bit about the results of the study that UT did on the behavioral mental health assessment that they did. I think they spent the last couple of years working on that, and kind of walk us through maybe the highlights of that assessment, but really focus on how the department plans to use the findings from that information, or use that information to determine what we're going to fund, how we're going to fund, how we're going to address the needs that are identified in that study. So that's a primary focus. But with that, Commissioner, I will turn it over to you.
Thank you so much, Chair Lady Hazelwood and incredible members of this committee. We're always honored when you ask us to come before you and very grateful to be able to report out to you what the study said. At the desk with me is Matt Yancey. As you all know, Matt serves as our Deputy Commissioner of Community Behavioral Health Services and has done an incredible job in that role. Many of you are aware that over a year and a half ago, we were asked through legislation to do a review, a study related to the needs across this state related to students' mental health and substance use concerns. In front of you, you will see the first slide. All of you should have received the complete report on the study. We sent that out right after we were given that and able to send that out. But this is sort of a condensing of what was in that study. When you look at the Project AIM slide, you'll note that the goal of this study, as laid out in legislation, was to map the mental health resources and services that are available for Tennessee's K through 12 students within schools and communities. Secondly, to map the landscape that helps inform a strategic approach to fill the gaps and unlock the existing community resources that we have. When you go over to that right side, you'll see the background, and these are items that are taken from the study based on research and facts. Number one, youth mental health problems are escalating nationally. In the audience is our new Assistant Commissioner of Children and Youth Services, Miss Beth Goodner. If you'd like to wave, stand up. I will tell you, Beth's background, she was the CEO of Trust Point Hospital. And one day we were talking, and she said to me, "We have every bed filled in our kids' unit. Every bed filled. And the majority of these children struggling with suicide issues. Every bed." Student mental health and well-being is strongly associated with academic success, so it's a win-win if you invest in services early on with kids, because the better they feel, the better they can understand and succeed academically. The third bullet there is an increasing reliance on schools to meet student mental health needs. There's a lot of research that schools are feeling pressure to meet the mental health needs of their students. An increase in student mental health problems and strain on resources due to the COVID-19 pandemic. Last year, I came and spoke to you all about that research that was done nationally and in our state by the University of Tennessee in East Tennessee. And then the Tennessee educators identifying needs to increase mental health supports at the local level. Many of you have spoken to me at times about your principals or superintendents who have said to you and teachers that they need more help in that area. When you go to the next slide, it outlines the survey questions. Here were the type of questions that the participants were asked. What types of mental health services are offered? What's the familiarity with the specific mental health training and opportunities that already exist through the dollars that you all have allocated, as well as what TennCare has in the system? How are schools and communities and agencies collaborating to provide those services? How is data used to drive decision-making related to those? What's the barrier to provide those services? What is the gap? And then what is our opportunity to expand those existing mental health services? To give you a couple of ideas, if you look at the school survey, because 2 surveys were given, one to the schools and then one to the community agency. And we actually have in the audience one of our CEOs from a community agency in West Tennessee. Jimmy, do you want to stand up, sir? It's my understanding you all filled this out. So if I look at what the community agency survey says, it says our data regarding mental health needs and services shared between your agency and schools in order to inform the services provided and to coordinate care. So across the board, we got answers to that. And then from the school survey, what are the limitations or the factors that make it difficult for your schools to close the gaps in mental health services and resources. So after they did the survey, they came in with really 3 buckets of recommendations. Again, y'all have got the total complete feedback, but if you look at the first bucket, obviously we need to increase collaboration and coordination of the services that we have. They recommended that we increase collaboration at the regional and state levels, that we clarify the roles of school employed and community employed personnel to make sure that we're not duplicating services, that we clearly communicate the available services that are in our communities, and then we provide mental health trainings to all stakeholders. When you look at the background at the bottom, you'll note that stakeholders across the regions identified opportunities for further integration of community mental health providers into the school community and improve communication to effectively implement mental health services and supports. The second bucket was to increase capacity. They looked at increasing funding for the local education authorities and the community-based mental health providers to expand staffing. You all have done that, and you'll see that we'll be coming back in this next year to look at that again, to maximize capacity of existing personnel in schools, to provide mental health resources and supports for those LEA faculty and staff, and then to create a structure to support the implementation of integrated and comprehensive supports for students and families. Underneath that, you'll see the background that states survey responses revealed an opportunity to increase funding, resources, and personnel to meet the demand for the mental health services that are needed. Go into the third bucket, expanding usage of data to drive decision-making. You all know that for the funds that you give us, we're very focused on outcomes and have an office that actually does research. But they did believe that we needed to develop common language for data for mental health supports and services across the different areas, that we should collect and analyze outcome data aligned to the school success metrics, and then utilize data at the state, regional, and district levels to identify effective intervention strategies and to evaluate supports and services. Underneath that background statement, you'll see that the survey respondents noted opportunities to use data to drive decision-making and to measure outcomes. An administrator from the Southwest region noted, all schools in our district use data to make informed decisions about care. It's just a matter of being able to crosstalk around that data. And then finally, as you all know, there was $250 million that's been invested. As soon as our department is given access to those funds, we will issue an announcement of funding for competitive grant awards. Those grants will fund services based on this research that should include one-on-one and group mental health interventions for students, mental health training for faculty and staff, and mental health services and supports that extend to the families. The grants will be distributed equitably across the state based both on the number of schools and the student population. And what do we expect from those dollars that will be invested? We expect increased academic success that we'll measure, reduced truancy that we will measure, reduced discipline rates that we will measure, and increased graduation rates. We feel like that we can clearly demonstrate that if you invest in the mental health care and the behavioral health care that kids need, that you're going to see these outcomes. We're already seeing them with our school-based behavioral health liaison work, and we already have preliminary data on that. I'd also tell you that we have actually looked at the legislation passed related to parental consent. That is in all of our scopes. I want to make sure that y'all are aware of that. And then finally, I want you to know that everything that will go out will have to have a signed letter from that principal, superintendent, and some teachers in that community to say, this is who we want to partner with, and this is what we want to have happen. So it will be locally based on the needs and the strengths in that community. Chair Lady Hazelwood, that concludes our overview. I hope that we answered those items that you had asked us to answer, and we're open for any questions that you all might want to ask.
Thank you, Commissioner, and I have some questions. I know that several of our members do as well, so we'll just start working through those, beginning with Chairman Whitson.
Thank you, Madam Chairman, and good morning, Commissioner Williams. Again, I just want, and I've said this for years, I appreciate so much what you and your team do
Yes, sir.
for so many people in our great state. And we see these challenges of mental health issues more and more, and I think it's getting the attention that it deserves. So I have 3 questions. Just bear with me here.
Mhm.
The K through 12 mental health landscape report reference a multi-tiered system of support framework which identifies 3 different tiers for mental health interventions.
Yes, sir.
First question, provide an overview of these tiers and how mental health services are structured to provide care for children based on the level of care needed.
Yes, sir. So the tier system looks at the different intervention points and, sorry,
Okay.
the tier system looks at the different intervention points and which populations get touched. I always mess up which one's tier 1 and tier 3. So which one is the most intensive? Is that tier 3? Got it. Okay. So tier 3 is where we're really focusing a lot of our effort, because that's the tier where you have harder need students dealing with harder issues around mental health and substance use, right? And so a lot of our services, we want to be able to touch that student, because a lot of tier 1 and tier 2, which includes education and also sort of technical assistance, is done in other ways. We do tier 1 and tier 2 services. And in our last report that we had with the school-based behavioral health liaisons, which I think Matt's got in front of him, he can tell you how many services, I think he can, that we offered. Okay, no problem. We cannot say that right now, but it's in the report. And if y'all want us to send that to you, we will. But it's really, it tiers up to the most intensive, which is individual therapy or group therapy, or actually connecting that child to a community mental health center. As you all know, the services are provided by our incredible mental health center partners. Alicia is in the audience. She's the executive director for the Tennessee Association of Mental Health Organizations, that represent all of the providers that these dollars go to provide these services.
And kind of a follow-up to that, are you finding some more, are services more easily acquired in one tier than the others statewide? Do you find that?
Say that a little bit.
Yes. Are services more easily acquired in one tier over the other ones statewide, on a statewide basis?
When you say more easily acquired.
Yes.
So.
Are you finding one region
Oh, I see
more
what you're,
responsive?
okay. What I would say to you is every dollar that we give out to our providers, as soon as they've hired their staff, it's equally acquired. What's been hard, and y'all know this, is the turnover and the vacancy rate. So if there's any region where they're not getting the same service, it would fall back to, do they have the staff? Because as we've talked about before, you can't help people without people. So could I point to a region right now? Not really. They didn't really talk through regions not having certain things, but we will be able to when we get the funds and can do the research on it.
And Commissioner,
Yes, ma'am.
just interrupt here to ask a question. Help us understand, maybe everyone else does, but help us understand the process, the screening process,
Mhm,
how you determine if it's tier 1, tier 2, tier 3,
mhm.
and how we're making sure that we don't have children that, may have needs that aren't identified at all. So can you help me understand that?
Yeah, as you all know, we're not doing a universal screening in this state, so there's no mandated universal screening. However, kids come to services through different avenues. One might be a parent that calls the principal to say, my child really needs help. They're seeming anxious, they're seeming depressed. Can you link them to some sort of treatment and intervention? If they did that and they got linked, that's the tier 3 service, right? That's the more intensive service. Another avenue might be a teacher, and this happens a lot. A teacher that's working with a kid in school and sees that they're not able to concentrate or sees that that kid's being bullied, they will then talk to whoever that school-based behavioral health liaison is in that school and say, can you get a written consent? Can we have you talk to this child and see what might be happening? In that, it could be a tier 1, which might be educational, or a tier 2 that might be some kind of wraparound service, or a tier 3 that might be more intensive intervention. So it literally can be brought to the attention of the provider through different means.
And I think in reading the material, I saw that sometimes it's not just a child alone that needs treatment. It's a family situation or larger.
Absolutely.
So does some of that treatment, is that available in tier 1 and tier 2, or do you have to be in tier 3 before you bring the family more into
Mhm.
the process?
That's a really good question. I want to say again something that I'm so proud about in our state. If you're in this state and you have a mental health need and you're below 138% of federal poverty level and you don't have insurance, and we've got a lot of families that don't, then you guys funded the safety net. And that was the beauty of this program is we're linking resources. We're not asking you to double pay. So if a counselor is talking to a child and finds out that the family's also struggling with mental illness or addiction, they can use the safety net dollars to be able to pay for those services for that family. So you've got complete wraparound treatment. And that's what we were really happy about this being able to do. The other piece is kids that are on TennCare. Stephen Smith and his team have done a really good job of working with our department. So if a family's on TennCare, if our school-based behavioral health liaison sees that family, they can also hook up for services if that family has TennCare. Matt, anything you want to add to that?
I think with children that are experiencing the most significant mental health conditions, we refer to those as serious emotional disturbances. You really have to work with the entire family. I mean, it's a family disease. And I think as the commissioner outlined, the providers that we're partnering with the school-based services that we're already funding, that's their approach. They know, especially for those children that may receive tier 3 services who have the most intensive needs, to best support that student, that child, you've got to work with the family as a unit. That's just a best practice and one that we promote.
Chairman Whitson, I apologize. I interrupted you. I think you have another question.
Oh, no,
or
you had a
follow-up?
good question there, and I have one more, okay? And this is more of a statewide perspective, too. What are the most prevalent mental and behavioral health issues impacting children in Tennessee? And are these issues the same across all grades and areas of the state?
That's a really great question. If you look at the research that was done, you had a 40% increase in anxiety across Tennessee student population. We had the same increase in depression across the student population. We saw a higher rate of people attempting suicide, of kids attempting suicides. That is just unbelievable, and at younger ages than we've ever seen. And if you look at the older teen area, so like from 15 to 18, you're seeing co-mingled substance use concerns. So you're struggling with a mental health concern. You may be self-medicating or hanging out with kids that are drinking or doing drugs, and then that gets a co-occurring diagnosis. You see higher issues with that, like when a kid's over 13. 13 and younger, you don't see as many co-occurring concerns.
Chairman Whitson.
And Commissioner, in those things that
Mhm.
you identified, do you see a difference in which area of the state, east, west, or middle Tennessee, because of the loss of, say, population and economic challenges in the east and west part?
If you look at the relation of poverty to issues around mental health, you'll note that there are higher levels of mental health and substance addiction in higher poverty areas. That's why when the governor started focusing on rural communities and distressed counties that looked at those indicators, and our department really stepped up with that to do what's called the Project Rural Recovery, where we take vans and our providers actually go to that community where they don't have to travel outside of that county. You'll see that we've really tried to address the disparities, which is what you're asking about. Is there more concern in East, West, or Middle? When all of this started with the substance use and opioid epidemic, there was huge needs in East Tennessee, but that's really sort of gone across the state. So no longer do you have East Tennessee as the highest need. It's still higher, but not as high as it used to be. I hope that answers what you asked.
It does.
Thank
Thank
you.
you, Commissioner.
All
And
right,
thank you, Chair Lee.
Chairman Moon.
Thank you, Madam Chair Lady, and thank you, Commissioner
sir.
Williams, for being with us. And this is finance.
Mhm.
What is the current level of funding for the multi-tiered support system? And what level of funding is needed in order to provide the level of care that children need? And I know that's subjective.
So here's what I'm going to tell you, because we pulled the numbers because we knew y'all were going to ask that question. What we did is we pulled all of the programs that are funded in our department that focus on school-based services. And if you look at that, what you'll note is that our total federal amount, and this is pretty cool that we have written so many federal grants as well as gotten a federal block grant, about $25 million has been allocated through federal funds to provide services across our schools. And then if you look at total state dollars, that's about 25 million that's been allocated. During the special session, so you got a total of 50,652,000 for school-based services. During the special session, we actually came forward and said, you know, you've got an SRO in every school now, right? So that's a person that looks at your physical safety. Why not do a school-based behavioral health liaison in every school? Because they look at your behavioral health safety. We put that proposal forward, and I am sorry that I can't remember the actual amount. It was millions of dollars. Do you remember, Matt?
It was millions of dollars.
Okay, it was. We can get that to you. I apologize. I wish I'd brought that. But yeah, we have a plan, and if funded, we would love to have a school-based behavioral health liaison in every school. Mhm.
So I look forward to seeing those numbers.
Yes, sir.
And I totally agree that that is very much needed. Got an LEA that reached out to us, and
Mhm.
an elementary school teacher was stabbed.
Oh, wow.
And which leads me to the next question. The plan forward,
Mhm.
how much of what you're proposing is preventive versus reacting or treatment?
Okay, so you're talking about the trust fund money? As I was saying earlier, our goal is to put the majority of the money in Tier 3, which is intervention. But Tier 1 and Tier 2 do prevention, do education, do what you're talking about. What we're wanting to do is base it upon what that principal, that superintendent, and what that provider thinks is needed for that school. You have some schools that may need more prevention than they need intervention. Some schools that need more intervention, Tier 3, than they need the other. So I can't predict for you because we haven't issued the funding announcements. We'll issue them when we get the money to be able to do that. But I can tell you when they bring back in the proposals for the funding announcements, we'll be able to say how much went to which tier.
Thank you, Madam Chair.
And Commissioner, I guess to follow up on an earlier point when we were talking about the regionalization of
Mhm.
results and problems and so forth, I know the crisis stabilization units for
Yes, ma'am.
children,
Mhm.
that was set up originally in East Tennessee in
Yes.
2022.
Yeah.
We're now doing that in Middle and West, but
Yeah.
is there enough data for us to see how effective those were in
Yes.
East Tennessee and what
Yes.
worked and what didn't? So we're
Yes.
modifying that.
Yeah, let me say something about that. We could not be more proud of what's happened in East Tennessee with the Youth Crisis Stabilization Unit. It was done in connection with the UT Kids Hospital in Knoxville. And so the reason we asked to go ahead and expand to 2 more CSUs was because it was so successful. We have outcomes in the 80% of kids not having to come back into any kind of care. We have outcomes of kids being able to re-engage with their family. And I mean, it's been unbelievable. Plus the president of that hospital has also called me and called and spoken to Matt to say how wonderful it's been. We've worked with THA, Tennessee Hospital Association. I mean, everybody's on board. The Children's Hospital Association. This is going to be incredible when we're able to cite the other 2. So right now, the scopes, the announcement of funding's gone out for the 2 new youth CSUs for Middle and West. And once we get those up and going, it's going to be wonderful to see how that helps each community across our state.
And to that point, the crisis stabilization work in East Tennessee, is that limited to Children's Hospital in Knoxville? We have a Children's Hospital in Chattanooga. Are
Yeah.
they involved in this process? Are there, help us understand what hospitals are actually actively engaged.
Absolutely. So what happened is you got Helen Ross McNabb, who wrote a federal grant and then came and asked for some funding from the state to the governor to help put this project together because they went and got their own funding to start it. It is for that East Tennessee region and for kids that get referred from that East Tennessee region. As it relates to Chattanooga or Memphis or Jackson or Nashville or any other community, these 2 new grants that are coming out will allow people to apply in Middle and West. You'll see some other requests after our budget hearing tomorrow that will address the rest of the state.
I look forward to that,
Okay.
having a specific interest in one of those areas, as you might
Yes.
imagine.
Yes.
Representative Freeman, I believe you had a follow-up.
Yeah, before we get too far along from the dedicated personnel in each school, do you have any data that talks to the efficacy of having that person in the school versus an outpatient, or having to see maybe a contracted service? Is there any proof that shows that's more effective?
There's a lot of research done on a bunch of different models to do interventions for kids in schools, right? And there's a whole list of promising practices or evidence-based outcomes. We do know that to have a person that is in a school or at least in that community that someone can call is a very effective practice. Is it more effective than saying that you refer out or tell them after school to go somewhere? I don't know of any research that looks at that, but common sense would say to me, if I'm in this school and people know me and they feel comfortable with me, I'm probably going to do a better job than if I were outside. Matt, are you aware of any research that compares the 2 models?
I think there is research that shows a benefit that we often don't think about, and that's a benefit to the parents or the guardian. So if a child is needing mental health services and is receiving it in an outpatient setting, that often requires the parent to take off work, go get the child, take them to a community mental health center or a clinic or an office to receive the service and then bring them back. Whereas if the child is receiving the service there in the school, it's less burden to the parent. They're also missing less instruction time, which is a great thing. So I think there's a bit of research that shows that when you bring these services to where children naturally are, it can be impactful, but it's also a resource savings too.
Representative Freeman.
Yeah, I'd like to just add, thanks, Madam Chair. I'd like to add one more thing. Just from my experience, there's also, it does away with the stigma of mental health. If you've got parents that, want their kids to tough it up or outgrow it or rub some dirt on it or whatever nonsense they say, if you have the ability for them to get help in the school, it can go a long way. So I commend you for pushing that.
Thank you.
Chairman Hicks.
Thank you, Madam Chair and Commissioner. It's certainly good to see you and your staff here. Really, really appreciate it. And so just to unpack some of this to make sure that I'm following along here. So we have the report that came out, the K through 12. We have that report. And then also there was a survey done with the LEAs, which once we appropriated $250 million with the trust fund back in the 22 fiscal year budget, and then surveys went out to LEAs filled out the surveys, and then where did that go to the Department of Education at that time?
Yeah, and thank you for asking for the clarification. Department of Education started their own survey that went out, and then y'all passed legislation that asked for our department to do a survey, and we worked with them. The we was Matt, worked with their lead person to work with UT School of Social Work to do the second survey. So what you're getting is what was presented to us, focused solely on mental health and behavioral health. There was another survey that was larger that was not this focus. That's my understanding.
Okay. So the LEAs, so they gathered the information, and then there was a partnership, a collaboration between mental health and education, right?
Yes, sir.
Okay, then the $250 million, the proceeds off that trust fund, that will go to mental health or education?
It will come to mental health.
Okay. Talk about that just a little bit, because that worries me a little bit, because that
Okay.
seems like putting the middleman in where the Department of Education,
Mhm.
since that's their realm, seems like they would be
Mhm.
able to react a little bit quicker. And I'm going to tell
Mhm.
you, working in K-12 education, I can tell
Yeah.
you that they're drowning with
Yeah.
kids, and it's not getting, I don't mean to sell doom and gloom, but it is not getting better. It is
Yeah.
absolutely getting worse.
Mhm.
And the
Mhm.
problem is now that we are identifying kids. That's wonderful and great. But now the system is so saturated. Now it's like, okay, we've hurried up to get them in the system.
Yeah.
And so we hear a lot about what we're doing and what we want to do. But at some point we got to say, how are we going to do this? How are we going to move the needle?
Mhm.
And so that's what I worry about. Just tell me a little bit of, okay, how are we going to do this? When we come back next year, we're not hearing the same thing, because, the trust fund is the trust fund. We know that's not exactly turning out the way we hoped it would in the very beginning, but hopefully we'll land on our feet before it's over with. But so can you talk a little bit about, how now are we going to start moving the needle so we don't hear this same conversation? And listen, I know this is a
Yeah.
big problem,
Yeah.
big problem.
All right. So that's a lot, and I'll try to start with how we're moving it now with our collaboration with Department of Education. So we've got, according to Shannon, who's here from the Department of Education, about 1,864 schools across the state. Based on the funding that you all have given us and that the governor's put forward, it's our hope that we will have all 274 school-based behavioral health liaisons funded, and that will serve 333 schools. As more dollars are added, as I was saying earlier, if we could have a school-based behavioral health liaison in every school, you will see the needle move tremendously, but it's already moving tremendously for these 333 schools that will be served. And to the point about it coming to our department or education really wanted it to come to us because the focus is on mental health, behavioral health services. They want to focus on education. And so that was under the prior commissioner, and we've already met with the current commissioner and of course with Shannon and their team about how to move this forward. So I can tell you that our providers, as soon as they got the money, they started hiring people, even with the workforce shortage. So the issue is not that they're not getting people in there. The issue is what our penetration rate has been with the actual total number of schools. We only have enough money right now to serve 333 out of 1,864. Does that help, sir?
Yeah.
All right.
And then, so you mentioned a few minutes ago, you mentioned the behavioral health safety net.
Yes, sir.
So talk a little bit about that. So
Yes.
since that was appropriated, 6.5 million.
Yes.
So compared to what you were doing before you got the
Yes.
reports, compared to what are you going to do moving
Yeah.
forward?
Thank you so much for asking. Again, I got so excited about this because, rarely in this field do you get to get all the pieces together. I've been in this field now for 30 years. Rarely do you have everything covered. We do have everything covered with the dollars y'all have given. It's a matter of being able to serve the higher number of people. So how it works is this: the safety net is given to our providers, and they can provide to kids that are uninsured under the 138% of federal poverty level. They can provide every service that TennCare provides except for residential. We don't pay for residential in our safety net, but if it's assessment or it's therapy or if it's group or if it's transportation or any of those other services, the dollars are given to our providers to be able to provide that to uninsured kids. So when you hook that up, when a superintendent calls you and says, I've got this family, they don't have anything, nobody can help. Wait a minute. Even if there's not a school-based behavioral health liaison in that school, our providers have the money to do the safety net. And the safety net is a very simple one-page application that the person gets the service when the application's done. And we don't even come behind and get the identifying materials until when we come and do the monitoring. We're doing this as simple as we can to get people into service because we know you want to get the service at the time of the crisis or the critical event that's occurred. So that's how it's working, and it's working really well.
So the 6.5 million
Mhm.
for
The safety net.
Yes, for the Tennessee Resiliency Project. I should have practiced that.
Mhm.
Okay, so you've got that stream of money,
Mhm.
and then you're going to have the proceeds off the trust fund.
Yes.
Once those proceeds, knock on wood, start showing up,
Mhm.
does that combine into one stream, or will you keep
No.
that 6.5 separate?
It's going to be separate because again, you've got the pieces, right? So that safety net allows for the services for kids that are uninsured. The dollars that we're talking about allow for the connectivity or the assessment. It's not specific service funded if the kid's uninsured. So you've got the person in the school that's there to help assess, help do intervention if that's what that principal wants. And if they need higher intervention or higher services, they go then to the safety net funding and it gets funded there. So that's what I'm trying to say. We're not double dipping. We're attempting to best utilize state taxpayer dollars to meet the needs of really poor kids and their families.
And I think, of course, one of the most, and thank you for that too. And,
Yes,
and
sir.
so as I finish up, Chair Lady, one of the most important things I think is making sure that all this data that's being gathered
Mhm.
through all these different entities and through the different
Mhm.
reports, and making sure that there's some synergy there that we,
Mhm.
that how do we get the data so that we can see the whole picture of what's
Yeah.
going on?
Yeah.
And one of the, I guess, the final recommendation in the K through 12 mental health landscape report was to expand the usage of data to drive decision making, which I think is fantastic. Which I think that's what we all want up here. What's the data say, and then
Mhm.
how do we move forward with that? But what are the barriers that exist to make sure that everybody has access to that data?
Mhm.
Are there any barriers to make sure that all these entities, all the service providers, and everyone has access?
To the data.
Yes.
The barriers are manpower to be able to collect and put the data in a system. And we are looking at requesting a staff person because we've grown so much related to school and kids services to have somebody that we add to our research team to be able to do that. We're doing it now, but we're very, very stretched thin. So it's not as comprehensive as you spoke to. We'd like it to be more comprehensive.
And with that said, and my final question is, what are we doing to keep that confidential, that data confidential though?
We cannot release the names of any private information that we get. So we're not releasing any child, family, nor are our providers releasing that. HIPAA covers that. So it's de-identified when we do the report. You see numbers, but not names.
Okay, thank you. And that's it. Thank you very much for being here. And
Absolutely.
I would be remiss if I didn't say, I do want to say thank you to all those providers that are out there in the field. And I do say thank you for being here as well. And so I just want to go on record as saying that. Thank you, Chair Lady.
Thank you, sir.
I have a follow-up based on Chairman Hicks' question. You mentioned with the safety net
Mhm.
that does not, those dollars cannot be utilized for residential services.
We're not using them for residential services,
Okay.
no.
So if a child requires that kind of help,
Mhm,
how is that funded? Is that funded or
mhm.
what do we do in that case?
So 95% of the kids that are getting services related to our programs are on TennCare, and TennCare covers that. What we would attempt to do is to get an uninsured kid on TennCare to access that service.
Thank you. Chairman Crawford.
Thank you, Madam Chair Lady. In the report mentioned there, you said there were several resources in Tennessee that help link schools and community-based mental health providers together. And talking about the Tier 3 section, are there enough resources to help schools providing this service to get more down toward the targeted areas? And Madam Chair Lady, just to follow up with that, how does the provider these service to, can't read my own writing,
Okay.
these services to children currently?
Okay, so if you look at the funds that you all have invested in, the federal funds that we have several key programs for kids, right? But the one that we think can do the most to fill those gaps is a school-based behavioral health liaison program, because it's a person in a school that knows all of the resources in that community for that kid. So if you look at the numbers that I was going over, we think we'll be able to cover 333 schools with the 275 school-based behavioral health liaisons that we're going to have. And we have that gap because you got 1,860-something schools that need that service. So I don't know if that answers your question. I'm not sure I understand.
Yeah, that pretty much does. Madam
Okay.
Chair Lady, one more, going back to the crisis, mobile crisis. We were talking about East Tennessee.
Yes.
I think we provided some funding to do more of those. And I think y'all are currently putting the 4 in line now. And I think you're looking at a total of 12 throughout the whole state. Is that correct?
For mobile crisis?
Yes.
Right now, if you look at kids' mobile crisis, I think we are covering we're covering the whole state right now. Are you
Okay.
talking about the crisis stabilization units?
Yes,
Okay,
yes.
that's for adults. So what you're speaking to is adults. But for the kids, we have one that exists right now in Knoxville, and we just got the scope announcement of funding out for the new 2 that will be in Middle and West. And then I was saying after our budget hearing tomorrow, you're going to see an idea that expands it to all regions.
According to the online here, it says that Murfreesboro, Clarksville, Paris, and
Yeah,
Dyersburg.
that's
were
the adult. Yes, sir.
That's the 4 that you are currently doing,
That-
or are they already in place?
That funding is out. They have not opened yet. They're getting the actual sites ready. building, rehabbing, but they're not opened yet. Those 4 are not opened.
Okay. So are you covering the whole state then?
We are right now. Right
Okay.
now, we're covering the whole state. The problem is that you have to travel further. So those 4 new ones will help individuals not have to travel far to get to an adult crisis stabilization unit.
Thank you, Madam Chair Lady.
Thank you.
I think one of the things that Representative Crawford alluded to was a capacity issue.
Yeah.
And you mentioned earlier, Commissioner, you can't help people without people.
Mhm.
So
Mhm.
regardless of wonderful intent by our community providers and all of us, recognize, just like we're not able to have these counselors in every school at this
Yeah.
point in time, part of that is, I think, just availability of
Mhm.
trained personnel. So
Mhm.
are there any specific steps that are being taken by the department in conjunction with or separate and apart from by your department or the Department of Education to address that capacity issue?
Absolutely. We had asked for the last 3 years for different ways in which to help the pipeline to get people in to social services and want to do this kind of work. We were grateful that during the special session, you all passed legislation and funding to do that. Specifically, you've given money for our providers to offer bonuses to keep people that are trained and direct treatment individuals. You've offered money for scholarships to actually reach out to students that right now are in graduate school in a master's program to say, hey, why don't you come work for us? And what was the other thing that they're doing for the pipeline? Scholarships, tuition reimbursement.
Well, I mean, beyond the special session funding, which has
Mhm.
been super significant, I mean, we
Mhm.
anticipate thousands of people to benefit from these recruitment retention bonuses. There's going to be a
Mhm.
commitment period that they stay with that agency for at least a year after that bonus is delivered. But I was thinking about our high school outreach.
Yeah, that's a
where-
good, yeah.
Where we're actually partnering with the University of Memphis, University of Tennessee, working with local school systems and high schools to educate high school students about career opportunities within public behavioral health. I think we realize we have to go even farther upstream to direct people into these career opportunities.
Thanks, Pat.
Chairman Zachary.
Thank you, Madam Chair, Commissioner, team. Good morning. Most of my questions have been answered, so I'm not going to belabor the point. I just have like a more of an overarching question. So a couple of months ago, your team came and presented to a small group of us in our building, talking about just the mental health crisis we're facing as a state. And I believe the numbers, correct me if I'm wrong, were roughly 18 to 19% of Tennesseans were in mental health crisis before the pandemic, and now that number's approached 30%.
Mhm.
And so it's growing at a point where when do we come to the point of realization or admission that government cannot fix this problem, that government plays an important role as a conduit, but so many of the things we're facing, whether it's the complete breakdown of the family, the complete breakdown of the moral code of society. I was listening to a counselor yesterday talking about he feels like one of the biggest challenges children face right now is they have a device in their hand and they are just inundated with any and everything you can possibly imagine. So when does it come to a point where we have to take a completely different approach where we can continue to throw money at this and the problem continues to grow? It's more just this big overarching question, like what role does government play in this new 2023 environment post-pandemic to try to address an issue that's growing so fast? We could probably throw $5 billion at it, but it's not going to fix the problem. And I mean, that's just a big, like, philosophical overarching, but when do we
Yeah.
come to that realization and create a different path, a different level of engagement? So we're not having this same conversation 2 years from now and 40% of Tennessee are in mental health crisis. And no, that's not a knock in any way on your department.
Yeah.
It's just like,
Yeah.
we just, it's growing rapidly and we're falling further and further behind.
Yeah. Couple things that I'd say to that, because clearly we've been thinking about that and our providers have been thinking about that and the people that are suffering have been thinking about that. A couple things I'd say. One thing that we do every year with you all in our budget hearings is we show you the graph chart of what the prevalence data is related to individuals in Tennessee struggling with mental illness and substance use. But we break that graph chart down for the area that we focus on, which are people that are poor and uninsured, that don't have insurance, that don't have access to anything, right? They don't have access. So you don't see us asking for funds through government or taxpayer dollars for privately insured individuals. You don't see us asking for it for TennCare insured individuals. We're asking for it for the poorest of the poor. And what we do each year is to show you that goal. So we've talked a lot about how disheartening it was. I played basketball from second grade through college, and making goals and winning the games are really important to me. And we were very close to closing that gap on the mental health issue for the uninsured individuals. We had about a 5,000 person gap prior to the pandemic. And you remember that not all people want to seek treatment. So even with that 5,000 person, you're like, wow, we've gotten really, really close to being able through our provider network to meet the need. But now that gap has changed. The goal has changed. How to win the game has changed. So what are we doing to make sure that we're good stewards of taxpayer money? Number one, we're looking at how many people are we reaching out to, how many people have a need. So y'all have that record. Number two, our providers are doing more and more public-private partnerships than ever before, where they're looking at community foundation dollars, or they're looking at other agency foundation dollars, federal dollars, so that it's not just on the Tennessee taxpayer to fund the services that are needed. Number three, we're looking at how can we take technology in a positive way to reach individuals once they've gone through treatment. So one thing that we've done that cuts down on the need for increase for people is an app when you get out of substance use treatment through one of our programs where you're connected with people that are in recovery. So we're doing everything we can to serve that group of people that there's nobody there to serve. They don't have resources. And it is disheartening to see that that number's grown, but it doesn't mean that what we're doing isn't working. For that 40,000 group of Tennesseans that have been given services through the safety net, I'm telling you, it's working for them. For the 85-year-old woman that I got a call about this weekend from the Sumner County Chief of Police, and he said this woman was not accepted at an emergency department. She's 85 years old. Not accepted. They said she was too combative. And he called and said, I've got her at the jail waiting to be able to get her into treatment. And I said, we've got the service for that. We've got it. We'll get one of our mobile crisis team providers to do the assessment. They did. And then she was put in the state hospital. For those kinds of situations, people are getting help. It's just the need has grown, like you said, due to no fault of anyone. It's just how do we equip our safety net of providers that day in and day out are looking at a higher need than they've ever seen, a higher need than I've ever seen, to keep the hope going and to be staffed fully to be able to meet that need. Because we have so many success stories, even with the things that you hear, there's so many success stories for the people that get those services. And when that person gets that service, it stops generational things from occurring. So even though the need's growing, which we couldn't predict a pandemic and how that would impact people, none of us could have predicted how TikTok or any of the apps that kids use, I mean, those are outside of our control. But what can we do to mitigate and help people recover and be resilient so that they can be full members of our communities? That's where we're focused.
Thank you, Madam Chair. Thank you, Commissioner.
Chairman Williams.
Thank you, Commissioner, for being here and your team. I must admit, when I when I read through the report that UT did, and we looked at the three different groupings and the three different levels, it seemed to me as a legislator on finance, it seems like it was very esoteric. Like we
Mhm.
do a very good job of saying, here's the buckets, but we don't really say, here's how to empty them. And
Okay.
when I read the report, I walk away a little more frustrated, maybe because I'm not in your department and I really
Mhm.
don't understand the full length and width and breadth of it. But from a finance perspective,
Yeah.
we're trying to find out where can we best make the taxpayers' investment into things
Mhm.
that we know are working.
Mhm.
One of the concerns, I hope you can help alleviate for me, is that
Mhm.
we have so many cooks in the kitchen as it
Yeah.
relates to K-12 mental health,
Mhm.
and who's assessing those kids and who's
Mhm.
determining which kids need the most help. How can you and your department give me a comfort level that we're doing it the right way? Because when I look at this, when I look at the numbers,
Mhm.
we're looking at TISA, where we funded more coordinated school health folks. We
Mhm.
reduced those ratios. We didn't mandate them to local school systems.
Right.
When you look at the $8 million we spent this past fiscal year on school-based behavioral health,
Yeah.
which was through your department, I don't know. We haven't really discussed a whole lot about that money and where it's being impacted.
Mhm.
We got two different entities, the state government bringing in data,
Mhm.
and yet we don't have the counselors in order to provide those services. And so help me drill
Yeah.
down into, and I have some other questions that relates to that, but help me drill down into
Mhm.
why the way we're doing it is the correct way. Because when maybe by 2030 we'll get some net revenues from the $250 million investment. In my
Mhm.
mind, I'm thinking maybe we're better off for that money to go straight to our
Mhm.
school systems who are collecting the data, who are
Mhm.
touching the kids. I mean, Matt was just saying as a response to Representative Freeman's question, the school seems to be the point where mental health and students in
Mhm.
K-12 systems intersect. And so anytime we can meet them at that intersection
Mhm.
quicker and with the
Yeah.
right services, the better we are. So that is a long drawn out question, and I apologize for
Mhm.
that, but
Mhm.
you understand
I
the complexity and the concern I have that we're
Yeah.
we're putting money or good intentions, but maybe not the right way to do it.
Well, let me answer a couple of your questions the best way I know. The money that you all have given us, we have put it where the need was demonstrated and where we had data to show that those dollars should go there. And we did that in coordination with Department of Education and also with those local school districts. So we can for sure send you the report for the dollars that you've invested specifically, in my opinion, for the most effective program, which is a school-based behavioral health liaison who works in tandem with that principal, with the teachers, with the students in the school. I really can tell you that that is money well invested, and I believe that our counterparts at DOE would tell you the same thing. One thing that's been frustrating that we've had Matt and Shannon work on, and they've been great on this, is we don't want to duplicate services. So if y'all give money or the feds give money for services in a school, we got too much need to duplicate. So what we're finding is when you define what the school counselors are doing, and again, DOE's here if they want to speak to this, when you define what they're doing, it's not what a school-based behavioral health liaison's doing. They're focusing more on guidance counseling or on college counseling or on other things. They're not focused on that kid that's really struggling with mental health concerns. And that's why this program we believe is so important and has had the outcomes that I talked about earlier that we have reduced truancy. I've got that for the money y'all have invested already. Reduced discipline rates. We've got that data. Increased graduation rates. Don't have that yet. And then increased academic success. We have that. So I agree with you. And what the report spoke to was better data collaboration where we can see where our dollars are going with what DOE is doing and what they're funding. But I can promise you, we've got a stronger relationship with them than we've ever had. And I immediately reached out to Commissioner Reynolds when she got put in her position. And I feel good, very good about our collaboration and about the ability to take these hard earned dollars and put them in to places where they will make a difference. But I understand your frustration. I understand what you're saying about the report. The report was not put together to tell us where to invest, that you have to go here or there. They told us what the survey respondents said, correct? So we got that back. And then they said, here are the things, when you look at the tiered system that y'all have been asking questions about, here are the things within that tiered system that matter. Where we have focused a lot of our dollars is the intervention piece, that mental health piece. And that really is making a difference for those kids that are getting those services and those families that are getting those services. And we can send you I mean, if somebody will make a note that we get that to
Thank-
Representative Williams.
Chairman Williams.
Thank you. Just a couple questions, because there have been a lot of great questions today, and I'm thankful for my colleagues for doing that. When I look at page 12 of the report, it says in there about those very important tier 3 invasive intensive services,
Mhm.
that $6 million we put in for the child's behavioral safety net, that represented 2.5% of the total piece of pie. But just below that, the one that,
Mhm.
as a finance member of this committee,
Mhm.
gives me a little bit of concern. It says that there's 7.2% that's unfunded. So my question to you is if $6 million pays for 2.5%, does that mean that 7.2% is not getting any services at all, and that at the same ratio, it would be that we need to invest another $21 million, $18 to $20 million in?
Let me take a look at that real quickly. So we got the TennCare State.
Because that's what's so difficult
Yeah.
about the numbers.
Yeah, this is interesting to me, given what we know about the uninsured kids population. Here's what I would say in looking at this. Yeah, they're saying that 7.2% is not funded when they look at the breakdown of TennCare, grant-funded services, commercial insurance, children's behavioral health safety net, and then they're saying for Tier 3, 7.2% not funded. But if you recall, we're saying that about 5% of kids are not insured. So actually, I would say that it should have been 2.5% not funded. The rest are covered through people's grants or insurance. So that's something we should have caught, and we did not. And it's something that we'll go back to UT and ask them about. Because if I look at that, I'd say really it should be 2.5% not funded.
Okay, thank you. Final question, so my colleagues can answer some. Matt talked about the long-term mental health support services through serious emotional disturbances that our kids are facing across the state. When I think of long-term care services, I'm thinking something other than just counseling services in the school or in one of our community centers. Seems like this sounds like it's long-term care for children. As we get more data, as we understand the length, width, and breadth of the situation, how many current long-term beds or services do we provide for those K-12 students in our state? And what do you expect that capacity could be as we grow the data?
So on that area, as I said, we're not funding residential through the safety net. What I would need to do is reach out to DCS, because some of these kids are covered through them and they get residential through them. And then TennCare that funds residential. I don't have those numbers because that's not something that we're funding at this point.
Well, as a follow-up, it just seems to me like if that's the point which we're touching the child and we understand they're in a mental health crisis, then it seems like it be best suited for the child if those services were co-mingled in some way, or housed in your department if it is mental health. And so I look forward to further discussions with you about it, but it does give me concern that we're doing that different than we're doing all the other mental health services for K-12 kids.
Got it. Thank you.
All right, well, I have a number of questioners left, and I'm
Mhm.
going to ask that they be brief as we're well past time and we have other groups waiting to testify that. I want to make sure that everybody has an opportunity to
Mhm.
ask their question. And Representative Parkinson, you're next, followed by Representative Shaw.
Thank you, Madam Chair Lady. I was looking forward to my 8 questions too, but I'll condense it down to 7. I'm just kidding, Madam Chair. I do want to just comment on what the chairman just spoke on, the difference,
Mhm.
you know, with those that are covered by TennCare having access to residency
Mhm.
and
Mhm.
those that are under the safety net not. And yes, ma'am.
Can I say one thing about that? If they need residential and they meet the poverty level, we want them on TennCare where they can get that service. What I'd like to do is find out if we have any uninsured kids that we've covered that needed residential that didn't get it through TennCare. So I want to make sure we're clear. It's not that they're not getting it. They may be getting it through TennCare once they're put on TennCare if they meet the federal poverty level.
Okay, thank you for that. The last number I got from the Commissioner of the Department of Corrections was that 72% of the inmate population is on mental health meds.
Hmm.
72%. And it seems like we're in a severe mental health crisis. I was just on the phone with a friend of mine on my way up here
Mhm.
who was explaining to me that our friend in common, his wife, just committed suicide.
Mhm.
Just the other day, and we were discussing this, and we were discussing the fact that there's not one single person that I know that does not have a family member who
Mhm.
deals with severe, not just regular mental health challenges, but severe mental health challenges. I don't know if it's stated enough how much or how deep of a crisis that we're in our state. And when I say, I'm not exaggerating, when I say every single person that I know
Mhm.
has a family member or a close friend that is in severe mental health crisis today. And at some point we are going to really have to start speaking to the how deep of a crisis that we're actually in.
Mhm.
And with the amount of money that we're putting into it, it just pales in comparison to the actual crisis that we're actually in. I was thinking and wanted to ask, we identify or profile, children that have the likelihood to go into the justice system based on, the conditions that they're in, based on,
Mhm.
the community that they live in, and so on and so forth. Why is it that we're not profiling children or creating a profile or looking at a profile of those children that are more likely to suffer from mental health issues so that we can intervene before there is a crisis, not after the crisis?
There's a ACEs, the adverse childhood experiences. That really is that attempt to be able to see, will a child end up needing help? That's a strong preventative measure that can be used, and that is being used.
Okay. And would universal screenings help that, or what's our reason for not doing universal screenings?
Um, it's something that's not been really discussed fully or agreed upon among different members. So that's not something that we are doing.
Okay. Last question. The chairman from Knox raised some points, and I don't think we had this level of challenges that we're dealing with when
Mhm.
the state was involved directly in providing beds. And now, and when the state got out of the business of directly providing beds, we've somehow slipped into a crisis. And it's not all due
Mhm.
to the pandemic, because we were going into crisis before the pandemic, or
Right.
already in crisis
Right.
before the pandemic.
Right.
And so, what can we do differently to actually make a dent or provide some service that will help us to begin to start climbing out of this crisis that we're in? Of course, when we went private,
Mhm.
the amount of beds, the amount of opportunities were reduced, and I think that's factual. And is that not factual? I saw you with a little nod on your head there.
You may be right. I think we've reviewed some recent joint annual reports from the Tennessee Hospital Association. I do think for acute inpatient psychiatric beds for children, I think that number has gone up.
Right.
But we distinguish between short-term acute beds from long-term residential beds. So you may be referring to more long-term settings.
I'm referring to whatever you're referring to. So, but my point is this: you look at the correlation. There has to be a direct correlation between the state getting out of the business of mental health and 72% of the inmate population being on mental health medications, meds.
Yeah, I'd like to say a couple things
Yes,
about that, and I haven't spoken to my colleague, and I will, because 72% sounds like a really high number, so I'd like to ask him about that. We didn't get out of the business of beds, and what Matt's speaking about is what's really important. We do have beds. We have 4 state hospitals and then 3 East Tennessee private hospitals that actually provide more services to more people than when we had 5 hospitals. So I think that's important to know. The other thing that we look at is what other hospitals are providing beds, and we did a comparison from 2013, right before Lakeshore closed, to now. And we do have more beds for individuals in this state than we've had before. So, we can send you that graph. I get it updated every year to look at it. That's important. Want to go back to the universal screening. We do fund SBIRT, which is a voluntary screening for kids. It's a brief intervention referral treatment screening. We've done work with local pediatricians, health department, schools to do that, but it's voluntary and not mandated. So I want to make sure I don't walk out of here with people going, what do you mean you're not doing screening? We're funding it, but it's a voluntary process and not involuntary. But I will follow up with Commissioner Strada to ask him, because that number is really, really high.
That number was alarming when I heard it.
Yeah,
I've heard it more
it's-
than, and I've heard it more than once,
Yeah,
actually, from 2
yeah,
different commissioners.
yeah.
But thank you, Madam Chair.
You're welcome. Thank you so much.
Representative Shaw, and I'm going to challenge you to be more succinct than your predecessor, and you'll be followed by Representative Sparks, and I give him the same challenge.
Thank you. Thank you, Chair Lady, and I will be very brief. Matter of fact, I was going to wait and not say anything. I've been listening throughout this whole process, and I'm not denying that any of this is incorrect, but what we did and what we're in the process of doing, the reason I was very reluctant to say anything, but we're in the process now of asking, what can we do through our churches? So we are now organizing as we speak, and we've got 25 volunteers that are ready to go to work next week in our departments of education.
Wow.
We've gone to the school directors and asked, how can we help? And we're starting as hall monitors. We need the training. So what I'm asking you, do you provide any training for us?
Absolutely.
Because we want to know now, rather than identifying all of the problems that we're having, how can we help?
Certified Recovery Congregations. That's a program that we started probably 12 years ago. It is phenomenal. Dr. Monty Burks, who's no longer with us, he's with the governor's faith-based group. Monty is the one that was the director. We have a new director, and really look forward to, we'll reach out to you about becoming that, which provides training for mental health, substance use, and what you can do today and what your congregations can do to really help with this issue.
So I can expect to hear from you.
You're going to hear from one
See
of our
how short I
staff. Yes.
was, State Chair. Thank you.
I congratulate you. Representative Sparks, you rise to the challenge,
Thank you.
please.
Real quick, I'm supposed to be in a class right now. It's a digital media class at MTSU. My professor is a brilliant guy. He's a TikTok celebrity influencer. I'm trying to get him to interact with the class with social workers and other behavioral experts. We hadn't got approval, so if Dr. McPhee is watching this, with this guy needs approval. This is how you reach these kids. Even though we banned TikTok, it's a little awkward, just saying to be in his class. But you reach these kids with the social media, it's off the rails. I called Bill Ketchum the other day and I talk about confirmation, Representative Parkinson, confirmation, because it's at crisis level. Call Bill Ketchum, who's with MTSU, said, man, I need approval for my instructor to do this video. He said, okay, I said, this is a serious issue. Alice Rowley calls me, happened to hear it from Alice. Bill calls back. You know what Bill says, Representative Parkinson? This is why this is serious. You know what he said? He said, we had a suicide this morning on campus. It ain't no laughing matter, folks. You can laugh all you want. You can say, well, Mike, you're going to take 3 minutes when you took 20. Okay. You reach them on TikTok. Let's leverage higher ed. Let's leverage brilliant people like my professor, Dr. Raj. You got to reach these kids. I don't want another damn suicide on my effing campus. It could be funny to some people. It ain't funny to me. I appreciate what you're doing. All hands on deck. Let's start a task force, ongoing task force that meets weekly with higher ed, with K through 12 administrators, with faith-based community, and get these folks on board. I don't want to see it happen in my district like it happened last week. Thank you, Chairman.
Thank you so much for that. One thing that I want to add is that another thing that we're doing through the certified recovery congregations and through that office is college outreach. And we have a person that does that who's in recovery himself and is working with campuses across this state to be able to reach out to students and having students help students, because in addition to what you're talking about, students listen to students more than they listen to other individuals. Thank you for that.
Representative Barrett.
Am I bringing up the rear of the train here?
And you have to bring it in fast.
Bring it in.
Super quick. All right. First of all, just a quick comment. I was caught a little off guard to hear one of my colleagues that ordinarily would probably be very opposed to profiling to prevent future behavior sit here in this committee and promote that as an idea for our kids. I think we need to be very cautious about that. But that's a sidebar. We can take that conversation offline. I want to talk to you about the AWARE grant program. You mentioned earlier about specific instances of good outcomes. And I've got in Hickman County a school board member that came to see me about a month or so ago, lauding this program in Hickman County. They got a 5-year grant, and the grant money is running out. And I mean, he told me 2 specific instances of lives that were saved as a result of the counseling that was going on through this program. So the concern that he has, that he's expressed to me and that I now have to express to you, is what happens when this funding runs out? What happens when this program or programs like it across the state and counties that are relying on that, what happens when that funding's gone? Is there a plan to replace that?
I'm going to have Matt speak to that because he's actually worked with DOE on what we do with that grant. Matt?
Yes, ma'am. Really quick, so the Project Aware grants are coming through the Department of Education. We partner with DOE on those grants. We provide consultation services to the districts that participate. I do think SAMHSA, who's the federal grantor on it, they're continuing to offer continuation grants, future grant opportunities, and we're obviously willing to help support any local district or our partners at DOE in pursuing future funding. I also think when funding comes to fruition from things like the trust fund, our providers want to work with those school districts to obtain new funding to sustain programs that are already in place.
Commissioner, we have gone well over time, and I apologize for that, but I do thank you. As you can tell, we all recognize there's a huge problem, and I think Chairman Williams and others have mentioned what we want to do is our due diligence as a finance committee to try and ensure that we're directing dollars in the most effective way. And we talked today about K through 12. That's a critical piece. We know that our children are in crisis. Something that we haven't talked about is the cliff that many of these kids will fall off of when they graduate high school or reach 18. And, what is there, what kind of safety net, what kind of services are there, because a lot of these problems don't just magically
Right.
dissipate.
Right.
They continue into adulthood. So obviously, there's
Mhm.
much work to be done, but we do appreciate your willingness to
Mhm.
come today and sort of help us understand
Mhm.
the department's thinking. It's unfortunate. I was hoping that we would have time to have education and you kind of jointly because there's so much overlap in this,
Mhm.
but we'll have to deal with that
Mhm.
independently. Maybe during our budget hearings, we can get back and talk about how this hand-in-hand collaboration is going to work
Yeah.
and get more information on that. But again, I know it's a busy time, the governor's budget hearings and
Mhm.
all other things that are going on, and a little holiday coming up, followed by
Mhm.
another one. And
Mhm.
so we do appreciate the fact that you were able to work us in on fairly short notice. So thank you as always for giving us a lot to think about. So,
Chair Lady, one thing that I'd add, you were talking about what happens at the cliff. Again, that's why this is so wonderful to see. If that kid has been seeing one of our providers and they turn 18, they automatically go on to the adult safety net. They don't lose that service. That's why this is so incredible what y'all have funded. It is seamless. So I just want to make sure that you're aware of that piece.
I wasn't certain.
Yes,
So
yeah.
that I just know from dealing with kids in foster
Yeah,
care, there are
yeah.
all kinds of places that
Right.
we
Right.
act like at the age of 18, there's some magic wand is
Yeah.
waved and everybody is independent and able to
Yeah.
take care of themselves. And that's just not the case.
Yes.
All right. Thank you
Thank
so
you
much.
so much. All right.
Next, I'm going to ask the Department of Education and the Department of Safety, if you guys could both join us up front. So we're going to talk about SROs and those kinds of issues that are, again, a joint effort with the department, your two departments. Well, thank you all for being here. I know, as with the Commissioner of Mental Health, you all have many opportunities for places to spend your time at this point in the yearly cycle. So we thank you for making time for us today. Our goal here today is just to help us understand a bit more. The legislature, the state of Tennessee taxpayers have invested a great deal of money and time and effort into doing what we reasonably can to make our schools safer. And we just wanted to hear, outside of budget hearings, just have a better idea of how those programs are progressing, what gaps there might be, and what, if anything, we might need to change in our approach to get to the end result that we're all looking for. So with that, I would just ask, we'll start with the Commissioner of Education. I'll just ask you to introduce yourself and your colleagues. Then we'll go to the Commissioner of Safety, and then whichever one of you wants to kick off, feel free.
Thank you, Chair Lady. I think they've asked us to go first. I'm Commissioner Jeff Long, Commissioner of Safety and Homeland Security. Elizabeth Stroker, our Director of Legislative Services, and Assistant or Deputy Commissioner Greg Mays, who is over our Homeland Security Division. Thank you for giving us the opportunity to come and present to you, especially after you've supported this SRO program all through the last session. Let me say first to our partners at the Department of Education, thank them for their partnership in helping us get the program out to the law enforcement agencies and to the local agencies who use this money. I think it was March or April that we were told that probably $140 million might come to the Homeland Security Division, Department of Safety, and be given for school resource officers across the state of Tennessee. And of course, the budget year starting in July 1, that gave us, 4 or 5 months to get it ready. I'm proud to tell you that our great team, and with cooperation of education and also with finance administration through the STS, we were able to start a computer software to do that, to actually collect the applications from the local agencies, collect the data that was needed, collect the memorandum of understandings that were needed, also applications that they would fill out for the funding, and then also have in place a way to monitor how that money was dispersed. And we were able to get money out the door the first week of July. And we started getting money to the agencies the first week in July. As of this point, 1,355 out of the 1,815 schools have been covered under the grant program. All 95 counties have taken advantage of the SRO program. There are pending contracts at this time. Knoxville PD has 6, Knox County Sheriff's Office has 42, and Millington Police Department has 1, in addition to the 1,355. $101,625,000 has been dispersed out of the $140 million so far. Chair Lady, thanks to you, you brought to our attention about the charter schools and making sure they were covered. We have started with our local law enforcement to make sure that when they're planning their SROs, they plan them for the charter schools. And there's been 8 charter schools covered, and those were in Hamilton County. The sheriff in Hamilton County tells me that by January, he will have every school and every charter school covered with an SRO in his schools. One of the things that naturally takes a little time on this is getting the SROs trained by the local agencies. Our partners at the Department of Commerce and Insurance have constantly had school resource officer training in order to help the local partners get the personnel that's needed for these positions and try to get those in the schools as quick as possible. And our highway patrol troopers, we have asked them to patrol the campuses of schools, also go up and check doors of schools, go up and meet with the school resource officers, go up and meet with the principals, administrators of the schools. And as of today, they have done 58,439 school checks. And lastly, due to this body's generous approval of our Homeland Security agent request that we made, we have 56 agents that are now out in the field that will be coordinating our school safety teams with education, mental health, and the other law enforcement partners in every county out of the 122. And we have schools set for January and February to finish out the number of agents to get them out into the field. I know that's quick, but I wanted to give you a brief time of a synopsis of it and give you time for your questions. We'd be glad to answer any questions anyone might have.
And we do have some questions directly, I believe, for the Department of Safety, and then we'll ask that you all just remain so that after the Department of Education finishes, we may be doing some ping ponging. Okay. But first on my list, I have Chairman Keesley.
Thank you, Chair Lady. Appreciate it. Thank you for being with us, Commissioners. Good to see you again.
Good to see you.
And your team members. I think you've already, of course, stressed some of this. But anyway, I'm going to go ahead and ask. So after, how long does it usually take for an MOU for the agency itself, the law enforcement agency, to receive that funding for the SRO then?
We prepared a standard memorandum of understanding that we asked every education group across the state, local law enforcement, and the county mayor and city mayors to use. So we standardized that form and put it in the application process on the computer. So once they make application, they automatically get the MOU. Yeah. They go ahead and fill that out and submit it back to us as soon as they get the signatures on it. Once we get that, we start the process for the contract. Once they get the contract signed back to us, the money goes out the door.
Great. So it looks like, sounds like a real quick turnaround then. So the grant, are these grants, are they issued on a how are they issued? On a reimbursement basis or how?
No, sir. It was easy for the first year for us to go ahead and give them out and have accounting to account for those to make sure the expenditures are properly at the end of the fiscal year. And that's what will be done. We didn't have the time to do it on a cost basis because we would not have gotten the school resource officers in the schools quick enough doing it that way. So they had the money out front, and then we're going to audit all of that as we go along. And also, we have prepared and sent to you, the legislature, the first quarterly report of each one of the agencies as to how they have spent that money and how much they've had and the number of school resource officers they've hired and such. So you should have that report.
That's, well, that was going to be my final wrap up then. Question is, and you've answered it. Thank you very much. Appreciate it. Thank you. Thank you, Chair Lady.
Thank you.
Chairman Faison.
Thank you, Madam Chair. Commissioners, good to see y'all. Hope
Good to see
everybody's well, getting ready for Thanksgiving.
Very blessed. Thank you.
We're thankful for y'all. Couple questions I have. Commissioner, are there limitations on what the funding may be used for? And could local governments use the funds on the one-time costs, such as purchasing cars for the SROs or safety equipment?
Yes, they can. As long as they can tie the equipment to that SRO, whatever expenditure they have above the salary, they can use for whatever they need to.
All right, my final question, of the 140 million that was appropriated, did the Department of Safety, did y'all retain any of that? And if you did, how much is left? It's all been dispersed.
Well, the only amount that's less is the ones that have not made the application or been approved in the process yet. That money is still sitting to be issued to those agencies once they get their process completed.
Chair Lady, can I have one more question? So that you just caught me when so we have some communities who have not requested this funding.
Right.
Do you know, Commissioner, do you have somebody in your agency who spoke with those communities? Are we anticipating they will apply and they just haven't got it together yet?
Yes, we are hoping they will. I personally called 3 agencies who had not completed the process and asked them to get it done, and we got those 3 agencies completed within a week.
Okay.
So yes, we have reached out to every agency that has not completed the process to make sure they're aware.
I wouldn't usually speak for everybody on this committee, but I would say any of us, if there's one of our communities who have not applied for that money, any of us would be more
Like to
than
know
happy
it.
to reach out to our people. So,
We'll do that.
Thank you.
Be glad to.
And just a follow up there, I know in my LEA and probably others across the state, there already were some SROs in place. So do we have an idea of how much of these funds have been used to supplant? So the school district now has gotten money from the state, so they've taken the money that they formerly spent for an SRO and done something else with it. So I'm trying to see how much of an increase we've actually had in coverage versus how much has been just replacement.
We
know that there have been over 300 new additional officers hired and placed in schools already this school year, and that number continues to grow as additional officers are trained and hired in schools across the state.
And if you would identify yourself for the record.
Yes, ma'am. Shannon Gordon, Chief Operating Officer, Tennessee Department of Education.
Thank you. And I think, Commissioner Long, you mentioned that you have some pending contracts, or MOUs,
Yes, ma'am.
with, particularly in Knox County. And I know that when we look at the urban counties, the larger school districts, the percentage of, I guess, the take rate, if you will, has been a bit lower in Knox, Shelby, Rutherford, Davidson, and Hamilton. And I know, our Sheriff Garrett in Hamilton County has been working really hard to bump up those numbers. But can you help us understand if there's specific things in those counties that have made this process more difficult? Is there something that we should be, targeting those counties differently, or is it a capacity issue I know how difficult it is for the sheriff, my local sheriff, and I assume others, one of their difficulties is just simply finding the folks to hire to train. So can you help us with anything that we could do to improve those numbers in those larger urban districts?
Chair Lady, I don't know there's anything we can do. As you said, the thing that we have found out from some of the larger departments is simply manpower. Getting the manpower hired, getting them trained, getting them into the process. We've give them the full year of the amount of their grant to get that done. So they have a full fiscal year to get that. Your sheriff in particular did well by reaching out to his local counterparts in the municipalities, and he has deputized those SROs as county deputies, which makes it all consistent. They all go by the same general orders. They have the same uniforms. They have the same procedures. So working in partnership with their own law enforcement agencies in the community has proven to be very beneficial. The sheriff in Memphis has 42 outstanding already. I don't know, I'd have to look at the list to see total number of schools, but I know I talked to Sheriff Bonner myself, and simply it was over getting the personnel hired and getting them on board in order to fill those positions.
And one of the things that was in a question earlier, we talked about the fact that these dollars can be used to purchase equipment, cars, guns, vests, whatever is needed, as long as it's directly for that SRO. But one of the problems, again, my sheriff shared with our delegation was that getting cars was maybe a 9-month wait. So what other supply chain issues are we still facing that would impact getting these SROs to be, I guess, up and running?
The main one I've heard is automobiles. There are some supply chains with equipment, weapons and things like that, but not near as great as the cars. I know personally for us, the Highway Patrol, we had about 200 or 300 car orders canceled and had to start over again. So everybody's facing that problem now. We have cars that have been ordered and coming, but everybody has faced that issue.
Thank you. Chairman Crawford.
Thank you, Madam Chair Lady. Based on the department's first quarter report, public schools are mainly using those grant funds for surveillance, communications, access control, and window film. Are there any restrictions that they can use that for?
Representative, I believe that would be Department of Education. Ours is only for the SRO. We don't allow it for film for the windows and cameras and things like that.
Okay.
Sorry.
Can you all answer that question? Are there any restrictions on the school grants that they can't use it for?
So that each school has to, Shannon Gordon, Chief Operating Officer, Department of Education. Each school is required to do a safety assessment, and they can only utilize their funding for their high priority items. So the restriction would be limited to anything that falls outside of their highest identified needs.
Okay. Are schools able to enter into collective bargaining agreements for purchase of items that they need at a lower cost and to stretch those grant dollars out?
Collective bargaining agreements, are they allowed to competitively?
I think join with other LEAs, or are we talking, Representative Crawford or Chairman Crawford, about being able to work with other LEAs across the state or whatever so that you have a larger buying power?
Yes. There would be no prohibition from going out to find the best price for a product or service. It would be something that would be encouraged.
Okay, thank you.
And I apologize, we got into questioning of the Department of Education before we really gave you all an opportunity to do an overview. So Commissioner, again, belatedly, but if you would like to just kind of present an overview of your perspective of where we stand on this issue in your department, then I'm sure we'll have additional questions.
Yes, great. So my name is Lizette Reynolds. I am Commissioner of Education, and alongside me, I have Shannon Gordon, our Chief Operating Officer, who has been the point person at the department on this work. The this is really just going to be a general statement, and then we will get more into a presentation. But bottom line, we are very proud to be in this partnership with the Department of Safety and Commissioner Long and his team. Through our ongoing collaboration, we've provided our communities with centralized safety tools, resources, and supports that are available at no cost to schools. Thanks again to the work that y'all have done over the last year. We've collaborated at the state level to create one-stop access for threat reporting, threat assessment consultation, critical incident response, and general school safety guidance. We're also partnering with the Department of Commerce and Insurance on establishing new post-certified training for SROs to be hosted at the Tennessee Law Enforcement Training Academy starting this summer. And so to talk more specifically about the rollout for public and our non-public school security grants, Chief Operating Officer Shannon Gordon will make a presentation.
I think we just want to hit on just a couple of key pieces. Each of our LEAs were required to meet a number of grant requirements. All of these details we highlight in our first quarter report. But each LEA was required to turn in their security assessment, their emergency operations plan. The legislation required a change to that emergency operations plan. That deadline used to be November. It changed that assessment deadline to be July 1 so that we could ensure that emergency operations plans were in place prior to the start of the school year. It required drill logs to be assembled and turned in, emergency contacts, signed assurances, grant program narrative, and grant budgets to be turned in. All of that was done, and grant applications were approved. As the legislator asked, relative to his questions about what can be allowable or not allowable, each district submits a security assessment. They then prioritize their needs, and their funding then is locally prioritized to then utilize their allocation, which is based on student enrollment, to meet their highest needs. Those assessments that are done locally are done in collaboration with local law enforcement. The top categories of use on the public school security grants were surveillance, access control, window film, and communications equipment. On the non-public side, this was our first year running non-public grants. And we want to thank you for that opportunity. Those schools would like to thank you for that opportunity. This was our first time running a grant competition for those. We were able to start that process early. It required an extensive outreach process. We worked with non-public school associations, as well as working directly with non-publics. Many of those do not have a direct relationship with the Department of Education. We had to develop a relationship with many of them. They had to develop an electronic relationship with us, as we had to be able to exchange electronic information, as we had to be able to push money out directly to them. And so we had to train them up on that process, as well as get them to trust us in terms of being able to share information. We held a number of workshops with them in order to get them comfortable and to get them familiar with the very minimal requirements that were placed on this grant process. We were able to do that, and we have successfully been able to roll out most of that funding. We did reserve a small pot of funding for what we like to call the late to the table group of schools, who, despite our more than 50 outreach attempts to the non-public school community, notify us and you that they've never heard of this opportunity. So we still have a small amount of resources available to that group of folks who still are requesting opportunities to apply, and we'll keep that open until that remaining pot of funds has been expended. And so we continue to support that group of folks as well as they work, again, mostly on providing hardening activities in the non-public school realm for their grants. These grants, unlike the SRO grants, are a reimbursement grant. And so schools must purchase and expend the funds and then submit their invoices and receipts. And then the state reimburses their funds. Happy to answer any additional questions that you might have on these two grants for 40 million and 14 respectively.
Chairman Williams.
Thank you, Chair Lady. Thank you for being here today. Appreciate it. Hopefully you've gotten all the boxes unboxed, sort of. I had a couple questions for you. Obviously, prior to the implementation of this, in TISA, there was $20 million in reoccurring funded allocated for the school safety grants. Under TISA, there was also money set aside per student based upon the LEA's base funding. Based upon the monies that we contributed to the Department of Education so far, and those reoccurring dollars, do you feel like that this is enough money in order to going forward as it relates for school safety, or do you feel like that there needs to be more investment as it relates to those reoccurring dollars?
So I think that the LEAs would tell you that there is never going to be enough funding in the school safety space based on all of the challenges. And I think from the testimony that you heard prior to us coming into the room in the mental health space, that one of the biggest needs that LEAs are facing across the state is how to best support the mental health needs of their students. And certainly the work that we are actively doing with school safety in supporting the threat assessment teams, the addition of the officers that have been added to help support threat assessments, and that work is helping to shore that up. But I think we would be remiss to not advocate for our school districts to say we think that this is enough, especially when the equipment that folks are purchasing now with these funds doesn't last a lifetime.
Just as a follow-up, that's great. I understand the need for that. As a part of what we're trying to do, though, we're trying to figure out what that number would look like if we were going to find those revenues to allocate. So it would be nice to know, well, as it relates to these grant funds, we had $20 million set aside, and then each individual LEA spent all their money as it relates to TISA, or they've allocated those monies to spend towards TISA. And we, even though we got $20 million, we got $57 million worth of requests. What that would tell me as a member of this committee is that, you know, there's a shortfall of about $37 million annually. So that's kind of the number I'm looking for. It's not something that you have to provide to me today, but if it'd be good for you guys to share that with us as you get it.
We would be happy to bring that back to you. Thank you, sir.
Thank you.
Next on my list is Representative Garrett.
Thank you, Madam Chairman. Thank you all for being here. My question is directed to the Department of Education regarding the this past August in special session, we allocated or appropriated $10 million for use specifically for public schools and charter schools that did not have SROs. So my questions will relate to that. How many public schools and charter schools have an SSO versus an SRO? And related to that, are there any schools which have neither?
The answer is yes. We just finished collecting that data. It was due back on the 31st. We had a few stragglers, and so I'm not ready to share that data with you yet as we finish getting that data from our last few LEAs, but we'll be happy to report all of that data back to you as soon as I have it complete. But we will be allocating out that additional $10 million to those districts by the end of the month.
Okay.
And I'll make sure this committee gets that information at the same time.
Well, you answered my second question was when. So thank you for that. I do appreciate that. So my final question as relates to this topic is, will the allocation be based on an eligible schools ADM?
Yes, it will.
Okay. All right. And just in case those folks that don't know what ADM is, can you describe what that is for me, please?
Average daily membership. So it's really your student enrollment.
Great. Thank you very much for that. Madam Chair, those are my questions. Thank you.
Thank you. And actually, I think it's actually the people that show up, not just are enrolled, correct?
Correct.
Representative Barrett.
Thank you, Madam Chair. Good morning. With regards to the Tennessee Safe Schools report that was issued back in February, and it shows a 4-year trend for the number of SROs by grade band in schools. So across all public schools, is it easier to find SROs for particular grade levels in schools? Can you answer that? And then I've got probably a couple of follow-ups to that.
So I think it's a local law enforcement decision, but I would argue that local law enforcement and school districts collaborate on placement of SROs. And my belief is that they are generally placing SROs in high schools and middle schools first before they place them in elementary. So they're putting them where they think they have the greatest need for them and prioritizing that way. So I don't think that they're selecting, or they are selecting based on need versus, and they see the greater need at the high school level first and the elementary level last.
Okay. So are SROs evenly distributed across the state, or some locations having more difficulty? I know we've talked about that there's been some issues with availability of personnel. So are there parts of the state that are struggling with that more than others?
Our metro areas are the ones that we're seeing that are having the problem getting the personnel hired. On your other question you asked on elementary versus secondary, it's about a 5% difference is what the record shows, 5% more in secondary than they are in elementary so far.
Okay. So on that first question, I think the point of the question though is finding out, is there any type of challenge or difficulty in hiring for one level versus the other? Or is it easier to find SROs that can serve in the high school level versus elementary, or is it you just hire them and then train them and place them where you need them?
Representative Barrett, I'm going back to my days as a sheriff. It made no difference to me where the need was is where I put them. And of course, we now all know no grade is safe from having an incident. So the old theory of going high school first or whatever, I think that's out the window. I think we're trying to get every school covered that we can possibly get covered at the same level is what we're trying to do.
Well, and we thank you for that. That's what we're trying to do up here as well. So last question, are there instances that you're aware of where SROs are currently covering more than one school?
They are not supposed to under our grant formula that we gave them, and the funding is supposed to be for an individual school. The only thing I think we have to be careful for is the building of additional schools. At the time that the award was given, you have other schools now that are going in session that might not have been ready at the time. So there may be a need to look at that number eventually for the number of SROs needed for that.
All right, thank you.
A follow-up to that, I know in my school district, and I assume across the state, there's a movement lately. A lot of the schools that have been built, they're middle high schools. They're separate entities, but they're co-located on the same campus. So are we counting that as one SRO or two SROs?
Two SROs,
right.
Individual.
Thank you. Chairman Zachary.
Thank you, Madam Chair. My question's for Department of Education. Related to the grants and the requirements, the 7 requirements that of public schools to be approved for their grants, what were the requirements or were there requirements for public schools? And did they had to adhere to those 7 requirements of the public schools?
For
I'm sorry, private,
non-publics?
private. I'm sorry, I said public, but public. So private, did they have to adhere to those same 7 requirements?
They did not.
Okay. And then what was the cost? What is the cost to the department to administer those grants? Do you have any idea what the cost is and how that's being paid for?
So we, from the original $20 million that was given, that was absorbed in the TISA funding, $1 million of that was used to fund the administrative costs for the grant. That money is still utilized to fund the administrative costs. And so the department is utilizing that same $1 million to fund the administrative costs of administering these grants out of the department.
Okay. And Madam Chair, one more if I may.
And part of that
So-
includes training and other
Okay, so
things.
out of
That's
that,
not all
you said out of
staff.
that 20 million, it costs $1 million to administer those funds? Is that
That
correct?
includes training and professional development. But yes,
That seems like a significant amount of money to administer a $20 million grant, 1 million of that. What makes up that $1 million? You had mentioned some of the professional training and others, and other aspects of that. What made up that $1 million to administer a $20 million grant?
so that funding is funding 5 staff members that do other things at the department, including transportation compliance, and other things that make up the safety and transportation team. That also covers statewide training that's done in safety and transportation that we're required to do. So in terms of, and I apologize, I'm coming straight off of 7 days of prep for federal funding and getting down to the detail of what does every penny go and do for. So round numbers there. But that $1 million is covering sort of every cost we would have associated with school safety and transportation that the department is utilizing in that space. I'm happy to give you a detailed breakdown of exactly where $1 million goes, because I can do that. And we'll be happy to add it to Q2 reporting for you in that space. But that's doing a lot of additional compliance work. We provide a number of state mandated reports in the safety space to the General Assembly throughout the year. In addition to just administering this $40 million grant, the $14 million grant, now the $10 million grant, we manage a federal GISM grant as well.
So in the last, and I'm going to just dig in a little bit more on this. So help me understand then. So there was not a mechanism in place with the Department of Education for a $20 million grant. There were not the mechanisms in place to be able to distribute and administer those grants. So we had to spend $1 million to administer a grant when the Department of Education administered grants on a consistent basis. We had to spend, I'm just trying to understand, that we had to spend another $1 million. You know what? Actually, no, don't even answer that. I am concerned that we had to spend $1 million to administer a $20 million grant through the Department of Education. That is a concern to me. So I would like a detailed breakdown of that $1 million and why it cost $1 million to administer a $20 million grant when the Department of Education administers grants on a consistent basis. So if you could provide that detailed breakdown, I
I
appreciate
can, and
it.
please, it predates me. So when I call it an administrative cost, please don't let me over exaggerate.
Yeah.
That's a lot of bodies sitting around. That is money that is not going to an LEA. And so I just want to be clear about what I'm talking about.
Yeah, and I would like to know why that's not going to an LEA, why $1 million it had to be appropriated or had to be allocated for that. So if you could
I'm
provide that
happy to
detail.
provide
Thank
that
you very
to
much.
you.
And
Thanks.
if you would just provide that actually to my office, we'll
I
distribute to the
absolutely
committee
will.
because I do think that's a question that many of us would like an answer to. Representative Gant.
Thank you, Madam Chair. Thank you all for being here today. Question I have is a little bit outside of the public education arena. as you know, we've got Department of Safety. This is for you. We have the youth development centers across the state. And the one I have in my district has an education schooling component for those juveniles at that facility. Are any SROs used for any of these youth development centers across the state? And if not, can this money be used by a local sheriff to put an SRO in one of these facilities?
Mr. Chairman, there are none of them covered that I am aware of. We based the allocations of schools on the ones that Department of Education had a number pre-assigned for. And if that school had a number designated it by education, those are the ones we gave the SRO money to. So I don't think any of those have a number. Wilder Youth Center, I assume you're talking about?
That is correct.
The Chairman Moody Committee, the way the legislation was written, it was written for schools, not programs. And so I think what you're referencing is something that is actually designated as an at-risk program and not technically written as a school.
Well, it's my understanding that this is designated as a school inside the Wilder Youth Development Center. And I did not read anywhere in the law where it excluded that specifically.
I think that's something we may have to look into with DOE to see, because we've had conversations around alternative schools and schools that are more for at-risk. Could you give us a little time to look into it and see what that is and get back to you?
Sure, and I guess my point is what I'm trying to drill down into is, can my local sheriff, if my local school system is not using that SRO money, can my local sheriff use that money for a facility like Wilder? Because as you know, we're using troopers now to man that perimeter 24/7. And yeah, before I get too far in the weeds, if you could, let me know about that, it'd be greatly appreciated.
Well, Representative Shaw, you just confused me because you weren't in your allotted space, and I thought you had skipped out before your question.
They told me I'd be important, Madam Chair, if I sat on the front row, so that's why I came down here. Thank you. Just wanted to ask this to Commissioner. Thank you all, first of all, for what you do. I know that the jobs are very challenging, and I really do appreciate the jobs that the troopers do across the state of Tennessee. I want to say that to you because I travel a lot and they do an excellent job.
Thank you.
As far as the SROs are concerned, we were talking about where they would be stationed. I hear quite often about school shootings where people drive up on the school campus and shoot a student. Well, can SROs be stationed at interest? Maybe at the end where you enter the school in the evening times where strangers cannot drive on the school lots. Is that possible, or is there somewhere in the law that can't be done?
Are you talking about under the grant?
Under the grant.
Under the grant, if it's a school activity and that SRO is working a school activity, they are reimbursed for their amounts while they're at any school activity. Yes.
So if the school is turning out 2:30 in the afternoon time, SROs could be at the school entrance to kind of look at who is coming in to pick up students or whatever. I know a lot of cars in and out, but I hear about a lot of cars coming in and, drive-by shootings and those type things. And I just thought maybe that might be some area where the SROs could be very effective to prevent those kind of things from happening.
Yes, that is covered, and they can position themselves wherever they feel like they need to be.
Thank you.
Along with their education group, yes.
Thank you. Thank you, Madam Chair.
Chairman Williams.
Thank you. Thank you, Commissioner. Just had a question. It's not, you may not know the answer, so I'll give you an opportunity there. this body allocated $60 million for recruitment. We're going to try to divide those monies into two $30 million tranches as it relates to trying to get more law enforcement officers. That those monies were supposed to be distributed through commerce and insurance. One of the things that's come up, because there's such a shortfall in the number of law enforcement officers across the state, those monies, I know that they haven't necessarily fully been implemented, but the question is, has there been any discussion about using that $30 million for not just recruiting law enforcement officers to enter our academies, but also to recruit all law enforcement officers around the nation who may want to find Tennessee their home? To me, it seems like it would the shortfall could be better met in the short term if we were to find law enforcement officers that were post-certified trained in other communities, other states across the nation, to encourage them to come to a fantastic state like Tennessee. Has there been any discussion from your department with Commerce and Insurance about how that recruitment money could be spent?
Chairman Williams, I don't know that exact conversation about that money has been discussed, but we have had conversations, education, safety, mental health, commerce and insurance are all in the school safety team. And we have talked about recruitment and retention and how to get that done. If you'll give me just 1 second.
We luckily had our budget hearing this morning, so it's all on hand.
They told me to answer that ask that question. No, I'm just kidding. While you look. And then while he's looking for that, I just thought I'd also give you a primer on my next question. $75,000 per SRO across the state. If you came to Putnam County, you're gonna pay a law enforcement agent around $55,000. $20,000 could be used in this first year towards purchasing vehicle, providing geared services for those SROs across the state. I know in Chair Lady Hazelwood's district, you can't get somebody for $75,000,
Right.
much less give them the training and gear that they need and the vehicle in case they have to follow pursuit. So my question is in out years, in that scenario, in out years, are we going to move more towards a reimbursement for actual dollars? Because I know we were trying to get people in the schools, which is why we did it this way, but a reimbursement would be more fair to districts like Chair Lady Hazelwood's, where you can't find those people, where recruitment's already an issue, but you could say, okay, we're going to go ahead and hire this SRO. We're going to pay them $75,000 a year, and we're going to offset that gear in the first year, knowing that in out years, the gear is paid for. Have you guys considered that at all?
Yes, we have, and we've talked to the state comptroller about how to do that. The problem that we hear from the local law enforcement agencies is that they have to go back now, since they got it 1 year, they have to go back to their commissions or the city councils and get the funding up front again. And they had rather it continue as the way it did this year rather than a reimbursement grant, is what we hear from them. And on your other question, I can answer your question as far as the highway patrol. We have given 93 contingent offers to out-of-state police officers for the highway patrol. So we are recruiting from out of state.
That's great to know that. I guess what I'm saying is, of that $30 million fund, instead of paying for training for a new law enforcement officer, and let's say that cost is $3,500, could we not give a travel expense of $3,500 to a family who's looking to relocate here and to become a highway patrol officer?
I'll be glad to discuss that with Commissioner of Commerce and Insurance, see what their guidelines are.
Yeah.
I'm not aware of what their guidelines are.
I'm pretty confident that it's a little bit vague. You may want to ask us in spring to come back and clarify that. I think it's going to provide law enforcement officers, in particular here, it would be much better incentive to those 93 officers that you're recruiting from out of state to be able to say, we're going to give you money for a U-Haul and your gas, moving expenses to get you here, so that they can happen a lot sooner.
Absolutely.
I've got a couple of questions just to wrap up. Deputy Commissioner Mays, if you could speak to us about the threat assessment process. I know there was a lot of discussion during budget cycle last year about how and where and how many of Homeland Security agents to be deployed. And can you speak to us about that deployment, how that's working, and just where we are in this whole process of getting those folks engaged in our LEAs, and if education wants to speak to that as well.
Yeah, thank you, Madam Chair Lady. Greg Mays, I'm the Deputy Commissioner for Homeland Security. So we, the General Assembly, as you mentioned, look to fund one Homeland Security agent in every county. We got that money on July 1st, and as of today, we've hired 37 of that new Homeland Security agents. Adding that to what we already have, we've got 56 now across the state. So we have our next class of Homeland Security agent trainees will come in on January 21st. We hope that'll be a class of 25, and we're just going to keep pushing until we fill every county. The agents that we have hired are spread out across the state pretty evenly, all the way from the Johnson City area to Memphis. In fact, the counties now that are left are usually ones that are a little more rural. It's harder to find somebody that wants to be in that particular area, but we're recruiting and focusing on those particular areas as we move forward. Each of the new agents that's coming on board is coming through an internal academy that we created, a training program, so that everybody's on the same page. They're very familiar with the school safety initiative, why they're here and what their responsibilities are. And then we're encouraging them as they land in the particular county. And keep in mind with only about 56 of them, 56 counts me too, so there's a little less than that out in the field. They're covering 2 or 3 counties at the moment, and they're making contact with everyone, with all of the LEAs. They're participating in these threat assessment teams that are popping up and are getting started. And I just asked for the statistics while I was sitting here, and we've had 35 open cases this school year involving threats involving schools. So it's not 35 threats. There have been more than that, but we have open 35 cases across the state looking at particular threats in schools, and about 182 cases involving threats not directed at schools. So the agents are active in their investigations, and we feel like as we continue to fill those slots, we can make a difference in the prevention piece. Based on Commissioner Long's leadership, I've made it a focus that we work in the prevention area. Response is important, and being ready to respond to a school shooting and all those things are vitally important. But we want to be a difference maker in the prevention area, and we believe we can do that. It's all the research shows us that when it comes to school shootings and school violence, somewhere around 80% of the shooters told somebody they were going to do it. And if we can pick up on those pre-attack behaviors and be involved in the prevention piece, then we can get someone off that pathway to violence. I hope that answers your question.
It does, and I want to clarify something which I'm inferring from what you said, but these 56 total agents, they aren't just for schools. This is just a part of their overall responsibility. That's correct?
Yes, ma'am. They're not just focused on schools. They focus on threats to life that may involve anything other than schools. We're working on some this week involving circuit court judges, for example. We also handle security around special events, around critical infrastructure across the state. We work with, we have a cybersecurity group that helps with misinformation and disinformation involving all sorts of cyber issues, particularly election security. And then we also help manage the grants that we've been talking about today.
All right. Sounds like these guys and ladies are pretty busy. The other question I have for safety and education, I serve on another committee where we had an interesting discussion in last month's meeting about the efficacy of the film that many schools, and I saw on the list, it was one of the top items that schools are getting funding for with their safety grants. I've been told that there's a limited number of companies that are certified for, there's different levels of protection. You can totally stop the bullet or you can slow the bullet down and all of these different things. But I've also been told that a lot of the effectiveness depends on the installation. And if this film isn't installed properly, then it's not effective. So my question is the accountability, the oversight of making sure that the money that we're spending for these kinds of protections and others, who's looking to make sure that it actually does what it's supposed to do? Is that something safety's doing? Is that something education is doing? Is that something that's totally the LEA's responsibility? What kind of oversight is there?
Me too. So according to our discussions with the State Fire Marshal's Office and the Office of Safety, there are many vendors and film products that could meet TCA 49618's definition of a clear bullet resistant or entry resistant film on the glass panel. From what we understand, the language used in the law was intentionally broad to allow for a variety of effective products to compete at different price points. Please note that there is a big price difference between bullet-resistant film and entry-resistant film, both of which provide a layer of protection and delay perpetrator entry time to differing degrees. It's in the best interest of the state, both financially and for the efficacy and efficiency of government, for there to be open and robust competition for the provision of government funds. We were surprised to hear that General Services believes that only one company's laminate is certified to be effective. And that testing standards that the vendor cited in the General Services is to the degree of protection that they deemed appropriate and necessary. And so we have not taken a position that there is only one vendor or one company that can provide a laminate. It's been our general position in new construction, which is a topic that our three agencies, DCI, Safety, and Education, meet on. Anytime there's new school construction in which DCI has to approve new school construction, an architect has to bring forward plans in which they have to put film on new construction. The architect has to certify the film that they put on. Our three agencies meet and review the architect's recommendation. And the architect certifies that that's the best product for that construction. We meet and confer. And then based on the recommendation and the manufacturer's specs and recommendations, we either agree or send it back for additional information. And so based on what the product is intended to do, we generally review and confer with what districts are recommending. But the intent of allowing film to be utilized was really intended to be a tool to slow down and give law enforcement greater opportunity to get on site to react. And so we have been supportive of products that intend to do that. The legislation didn't intend, nor did it require ballistic film to be utilized. And had it, it would have been cost prohibitive for most of our districts to have utilized that as a safety measure.
And I understand I think what you've just described is a very intensive process for new schools and installation, but on the retrofitting, because we have a lot more schools already existing than we're going to be building. So on the retrofit, is there that same kind of oversight to make sure that the product does meet whatever minimum standards they are, and that the installation is, if that is indeed, as I've been told, a factor, if the installation, don't necessarily have an architect if you're just
Installation
putting
has to
fill on.
meet the manufacturer's requirements. So each manufacturer is different. So what the grant generally requires and what documentation we've required in E-Plan back to districts is that they have to ensure that the installation meets manufacturer's requirements. So generally, the manufacturer is requiring that it be installed by a licensed installer. So I can't buy a roll of film and install it myself, for example. I have to be trained on proper installation of that film in order for it to be considered properly installed and then insurable by my insurance company locally.
All right, so that is the installation but I think what I'm hearing you say is the LEA is given these requirements or, minimum standards, then they can select their own vendor and installer, and they're basically responsible locally for making sure that the proper steps are taken, number one, to secure it, number two, to install it. Am I
Yes, ma'am.
correct? All right, thank you. Chairman Williams.
Thank you, Deputy Commissioner Mays. I just had a follow-up on the number of threat assessments. It was about 50% ratio, I guess you thought were school-related, and those that are not school-related. The question I had about those are, do you categorize those threat assessments based upon hearsay, or whether you think it's an extreme threat based upon how you do that? The reason for the question is there a threshold where you might contact the Department of Education and ask coordinated school health or one of the mental health providers to provide a mental health evaluation, or does your investigations only touch on periphery and you don't actually make contact with the person of interest as it relates to the threat?
Thank you for the question, sir. We approach all of our threat investigations with the same methodology. So first of all, we'll do a preliminary investigation to determine, what happened. So for maybe to illustrate by example, if we get a report that someone's going to bring a gun to school tomorrow, they're upset. First thing we'll do is talk to who made the report.
Mm-hmm.
How did you get it? What do we think? And then we will make an effort. Of course, we'll contact the SRO at the school, make sure everyone's aware at the LEA, and then we will seek to do an interview with the person the subject.
Mm-hmm.
And from there, we may find, it usually goes in two different directions. There's a potential for two different directions. One is, oh my gosh, I'm sorry, I didn't mean that. We determine very quickly that, say the kid it was a joke, right?
Mm-hmm.
Or it was a hoax because they didn't want to take the math test tomorrow or something like that.
Mm-hmm.
And that happens too often. What happens less frequently, but is more concerning, is that we begin to see that the kid was going to bring a gun to school. And maybe there's a set of aggregating factors that are deeply troubling. Social and environmental functioning is in a bad state. Maybe the kid's being bullied, but we have a problem here, and that's where these threat assessment teams, which the General Assembly made mandatory with the legislation last year, are so helpful. We pull everybody into that if they're not already involved. So the school-based behavioral health liaisons, the juvenile court, of course, the SROs, the education, the educators, the parents. We got to get, if the parents are not part of the problem, and every case is a little different, but it takes a deep dive and a persistent monitoring of that, because it won't go away tomorrow. We have to figure out what to do. Sometimes from the Homeland Security perspective, we want to try to mitigate the immediate threat. So for example, if the kid has access to weapons, then what can we do? Can we give the guns to Uncle Joe and he can take them, down to the next county? Can we do something there? Can we, if the kid's being bullied, let's try to get that stopped, right? We want to try to break the sequence of events that would lead to violence, offer another pathway. much of the violence that we've seen, the research tells us, I mentioned before, that kids will telegraph that they're going to do it, but although there's no profile of a shooter, often bullying and a feeling of desperation are present. So if we can find a way to eliminate those things or make them better, then that's what we try to do. So that we will always, to get back to your original question, we will always approach a report. I like to say we take every credible threat seriously. Where the investigation goes from there depends on what we find.
Are those it's me again? Are those interviews that are conducted by your department with the appropriate group? Are they done by someone dressed like you today, or are they done by a uniformed officer? Or how does that work?
Typically, under the best circumstances, what we would consider ideal circumstances, it would be somebody, a Homeland Security agent dressed maybe not as formally as me today, but similarly, and they might be with a uniformed officer, someone from the sheriff's office, for example, or maybe the SRO. Ideally, it'd be in a place away from the school where we can get a good idea of what's making this kid, what's troubling this person.
Okay. Thank you.
Representative Gant.
Thank you, Chair Lady. This question is directed at both Department of Education, Department of Safety. I'd like to know what your thoughts are on the school safety first alert systems that are out there, if you think they would be effective. And do you think that should be in the form of available grants to help schools implement those type systems?
Yes, sir. I think you're asking about companies like Mutual Link and others that offer instant communication and camera access and things like that. We have I've listened to some of the pitches from vendors such as them, and they're very, very expensive. I don't know that I have a fully developed opinion of them. I have a colleague in New Hampshire that uses a system like that for all the schools in their state, but New Hampshire is about the size of Shelby County, right? How would we do that in a state as big as Tennessee? So I don't have a good answer for you, sir. What we believe is best where we are today is keeping the doors locked and trying to investigate the threats to the school before they're at the doorstep.
Has there been any communication with the administration or in your department of further research in these type of application to see if they might be effective and grants could be available for schools that could utilize these type systems?
Yes, we have looked at it. We have had conversations. I believe the Knoxville School District uses a similar system, and I've had conversations with them. But finding one that would be implemented across the state, we haven't gotten to a point like that.
Well, I know there are several vendors that obviously, as you mentioned, that do this. And have any of y'all ever seen the actual system in use? Has any of the vendors actually showed you how they're operated?
I've seen demonstrations. I have not visited, anywhere where it's actually being used real time.
We had the opportunity when I was sheriff in Williams County where we had a system that the school security cameras in the school could be viewed by the deputies responding to the school. So we were looking for that initial upper hand before we stepped out of the car to know what's going on in the school. And we were able to use the tablets in our patrol cars to actually view the hallway cameras. We could pull up a camera wherever it was in the school to look at it before we ever got on the scene to know what the situation really was.
Yeah, that's accurate. I mean, there's so much technology that has advanced with these systems. I mean, there's some systems that even if a teacher hears a shot, or somebody sees something, they can, a lot of them have badges. They can push the button on their badge. It instantly sends out messages to all the desktops with the teachers, their phones, law enforcement. Everybody's notified of that instant when it occurs. And in some situations, it actually identifies where the actual closest officer is in that county in relation to that school and notifies that officer of this incident and says, you're the closest officer to this school. And as you mentioned, Commissioner, it allows him to use his laptop to pull up the cameras of that school, communicate as he's approaching that school, and know exactly where the best entry point is to stop that active shooter. And it also notifies every teacher, every staff person in that school of exactly what's going on the instant it happens. And they're able to lock down those classrooms and do the proper protocol to stop that active shooter from doing further, damage inside that school. I think these systems are the future of the safety of our kids across this state. And I would hope that we would take a further look at these systems and offering grant money for local schools to take advantage of this. Because we talk a lot about school safety. Well, here's an opportunity of technology in this day and time that can be utilized. And as you said, it costs money. But the investment that we put in this, I think the dividends are great here if we, spend the money and at least explore these opportunities further. And I hope that we do that. Thank you.
We will, sir.
Representative Love.
Thank you, Madam Chair Lady. I just want to ask a question about the window film. I was very intrigued by what you're describing. If you can, just give me some understanding about installation process and time frame, what that looks like, if that goes through.
So it depends on the manufacturer and what a district has selected. Window film, because it's been a popular purchase item, and depending on the manufacturer an LEA has selected, can be on back order. But it's ordered and gets installed and applied. It's generally goes right over your window with a window treatment. It is not a difficult process. I don't know how to further describe it to you. If you
Representative Love.
That helps. Just trying to figure out, is it designed to prevent the bullet from penetrating the glass, or to prevent the glass from breaking all up once the bullet goes through?
it depends on the type and the grade of what film you've purchased.
Okay. Thank you. Thank you, Madam Chair.
Thank you to both the Department of Education, Department of Safety, to again to the folks from mental health for taking the time in the middle of the governor's budget and a couple other committee things that are going on to spend some time with us today, but just to help us understand, we are responsible in this committee for putting together the budget that hopefully the body ultimately approves. And we've put a lot of money into all of the areas that we have heard from today. And I think we just view it as a part of our due diligence to try and understand, number one, if the monies are actually going where we intended for them to, and number two, if they're effective and Number three, if we need to adjust funding or reallocate or whatever. And so I think the testimony that we've heard here today from all of your departments will help inform us as we make those decisions going forward. So thank you again for taking the time to be here. I know we ran over time, but you're accustomed to finance time. So hopefully that's not a surprise to anybody. With that, if there's no other business, I heard a motion to adjourn. We're adjourned. Thank you, members, for traveling to Nashville today for this meeting. I appreciate it.